Doctors, well, when it started, it begins with 3 doctors. The first person I saw was Dr. Grosshans at the proton therapy, then my surgeon, Dr. Ferguson, and then my oncologist, Dr. O'Brien, which the way I met it was a little bit out of sync. It probably should have been surgeon, oncologist, radiologist, and some other order. But anyway, it is what it is. So the first person was Dr. Grosshans, and he's absolutely amazing. It's in this proton therapy, that just incredible piece of equipment they have here at MD Anderson. Dr. Grosshans, he's very quiet, very well spoken, super nice man. But when you come into his room, he tells you, we're going to do this. You know, he's kind of like, you know, Al Pacino on Any Given Sunday. You know, he's right. We're going to do this. We're going to fight this. We're going to do this. So he really builds you up as to the success rate of how good this is going to be. So that was proton. From there, across to here into the main building, and I've got to say that was somewhat of a tough day coming to the main building. So it was 2 weeks out from my first biopsy operation. So they'd literally just taken the stitches out, and I had to go and meet my surgeon, Dr. Ferguson, and her APN, Ufi. So I just sat down, and Ufi says, yeah, I think we're going to go back in. What do you mean we're going back in? I said, well, that was, you got a biopsy, but you didn't get an MD Anderson biopsy. So we do things properly here. I said, Ufi, come on, I've just had, the stitches have just come out and you're telling me you're going to pop the lid again? Yep, that's what we do here. Okay, let me think. And he said, look, think about it, but this is the best way of doing it. And eventually you talk to the doctors, think, okay, let's do this properly. Let's just disregard what's happened before, and we're going to pop the lid again, and we're going to go back in, proper biopsy, try to take out as much of the tumour as we possibly can, and then go from there. So that was the plan, and then met with Dr. O'Brien, the oncologist, and explained what the treatment's going to be like after. So that was good. Another appointment with Dr. Ferguson, and she explained the operation, which was incredibly cool. So she said, you're going to be awake when we're working on your brain. What? She said, yeah, don't worry. She said, what we'll do, we'll put you out, we'll pop the lid, I'll be working in there, but we'll bring you back. How do you do that? Well, she said, there's no nerve endings in your brain, so you won't feel anything. I'll be there. If we pop out the wrong bit, then you'll twitch and we'll know that we don't have to, we can't touch that bit. Okay, that sounds pretty good. And then she tries to explain it a little bit more. She says to me, you know that bit in Silence of the Lambs 2 where Hannibal Lecter's eating the guy's brain? Yes. She said, that's kind of true because you've got no brain, you have no nerves here, you can touch your brain, you won't feel a thing. Okay, Dr. Ferguson, but if you order Chianti, I'm getting up off the table and I'm getting out of there. So I talked to Dr. Ferguson about that just a few months ago. I said, do you remember telling me that? She said, yeah, it probably wasn't the best way to describe it, but you know what, it worked. So that was the operation. On the table, on my side, awake, scooping it out. The anaesthesiologist, Dr. Lipsky, he happened to be Scottish as well. So we were chatting, and the more I talked, the worse his accent got. So we were talking Scottish. And he's there with his assistant anaesthesiologist who's looking, going, I have no clue what these two idiots are talking about. So chatting. That's what it went. And then afterwards, Dr. Lipsky said, what do you want to do after this? I said, the Masters starts today. Can we watch the golf? He's like, yeah, sure. So finished up, stitched me back together into the recovery room. And Dr. Lipsky hung out for a little while. I said, okay, you're fine, let's go into the ICU. What channel do you think the Masters is on? It's on ESPN, puts it on, sitting watching the golf, and then my wife came up. She'd been down in the waiting room. So she came up, and she's expecting me to be full of pipes and tubes and things, and I'm sitting up in the bed watching the Masters. And she says to me, you know what, I hate when you watch golf, but see right now, I'm so glad to see you watching it. So that was the first operation. Pretty good story, I think.